Good afternoon. On behalf of the faculty, students, and staff of the Department of Behavioral Science at the University of Kentucky, I have the honor of reflecting on a few of the highlights of Bob's illustrious academic career. Bob had a truly remarkable career filled with innovative and impactful scholarship. He was a pioneer in recognizing the importance of multidisciplinary approaches to teaching and research, particularly applied to alcohol and drug research, medical education, and social justice. I will limit my comments this afternoon to Bob's impact on the field of alcohol and drug research, but it's safe to say that his influence in the areas of medical education and social justice were equally impactful. Carl Lukefeld, past chair of the Department of Behavioral Science, insightfully described Bob as a Renaissance behavioral researcher and a national treasure. Bob's interest in alcohol research began with a study of the development of the United States Public Health Service, which began with the provision of medical care for seamen. Alcohol played a prominent role in the day-to-day life of sailors who were critical to the early economy of the United States. The first of his more than 120 scholarly research papers, book chapters, and technical reports, appearing over a career that lasted over 50 years, was published in 1946. This was a study of alcohol use among homeless men in New York City. Perhaps the study that established his reputation as among the nation's top experts in the alcohol field was also the first epidemiological study of alcohol use conducted in the United States, a study characterizing alcohol use among college students. This study, which was published as a book in 1953 and reprinted in 1971, still serves as an historical marker of the impact of the application of scientific method to the study of alcoholism, a topic that for centuries prior to Bob's work had remained obfuscated in descriptions of failed character and moral decay. Throughout his career, Bob was known to offer occasional advice to his colleagues, and among the most frequently quoted of Bob's rules to live by was, "If you are in a community that is run by a committee, be on that committee." Throughout his career, he served on national committees and organizations charged with establishing or directing our national strategy for drug and alcohol use research and treatment, serving in many occasions in positions of national leadership. Based on the accumulation of his leadership and scholarly work in the field, Bob achieved among the highest honors that can be bestowed on a behavioral scientist. In 1975, he was elected to the prestigious and exclusive National Academy of Sciences Institute of Medicine. To this day, I believe he has been the only University of Kentucky College of Medicine faculty member to have ever received this honor. However, as remarkable as his scholarly career has been, I believe that Bob is an even more remarkable person. He was a quiet and peaceful scholar, but his intelligence was unmistakable. He was both gracious and generous in sharing wisdom and guidance with a light touch and a tender heart. I have been honored and humbled to have served as the Robert Straus Professor, but even more honored and humbled to have known Bob as a colleague, confidant, a role model, and a friend. He was a truly remarkable person who will remain timeless in our hearts and minds. Thank you.